Today we are diving into a very important women's health topic which every woman experiences but rarely talk about, and it is vaginal discharge. Now, before men scroll away, hold on. This video is also for you because understanding vaginal discharge does not only help women know what is normal or not, but it also helps men to notice any abnormal changes in their partners, show care, and encourage them to seek medical attention when needed. So whether you're a woman wanting to learn about your body or a man who wants to better understand women's health, this video is for you. I will explain the different types of vaginal discharge, their meanings, possible treatment in a simple and very understandable way. So ensure you watch this video till the end, because this might just answer the questions you've been too shy to ask. Let's dive right in. Hello beautiful people and handsome, welcome back to my channel Ask Your Nurse. If this is the first time of seeing my video, thanks for stopping by. I'm a registered nurse. This channel focuses on content related to health. Do well to subscribe to my channel, like, and hit the notification bell below to be the first person to know the next time I upload another new video. And to my returning subscribers, thank you guys for all you do. Vaginal discharge is a normal fluid produced by the gland in the vagina and the cervix to keep the area clean and healthy. It normally changes according to the time of the month in response to hormones. It is what every woman experiences, but not everyone knows what different color or type actually means. However, vaginal discharge can change in amounts, consistency, color, or smell, and sometimes it might be associated with irritation or burning sensation, which gives a clue to whether it is normal or a sign of infection or other condition. Now let's start with the most common type of discharge, which is a clear or watery discharge. This type of discharge is thin, transparent. It sometimes runs like water and feels a little slippery. This type of discharge is a completely normal discharge, which helps the vagina to clean itself and stay moisturized. You might notice this more during exercise, when you're sexually aroused, or after your ovulation, when estrogen level rises. Another one is a clear and stretchy vaginal discharge, which looks like a raw egg white. It is sticky and elastic. This is also a normal vaginal discharge, and it is usually noticed when you are ovulating. It is your body way of making it easier for the sperm to meet the egg for fertilization. And when you see this type of discharge, it is telling you that you are in your fertile window, when you have the highest chance of getting pregnant if you want to conceive. But if you don't want to get pregnant, avoid unprotected sexual intercourse around this period. The next discharge that I'll be talking about is the white or creamy discharge. This type of discharge is usually thick and milky, and it is also a normal vaginal discharge, which is usually noticed before or after period. This discharge helps to protect the vagina by flushing out dead cells. However, if this type of discharge becomes very thick, clumpy, and looks like cottage cheese, then it is no more normal and it is a sign of infection. This will lead us to the next type of discharge, which you can notice, and it is the thick, clumpy, white or creamy vaginal discharge. This type of discharge looks like cottage cheese, and the amount is usually more than the normal vaginal discharge you used to see. It usually comes with burning, severe itching, irritation, pain during urination, and painful intercourse. When you see this type of discharge, it means you're having candidiasis or vaginal thrush or vaginal yeast. This is not a sexually transmitted infection but an overgrowth of the fungi in the vagina. Naturally, this fungi lives in the vagina with other good bacteria, but it is this good bacteria that keeps the fungi in check to not overstep their boundaries. But any condition that reduces the number of these good bacteria will lead to multiplication or overgrowth of the fungi. And when this happens, we begin to notice thick, clumpy, white or creamy vaginal discharge, which usually comes with severe itching, burning sensation, irritation, painful urination, and pain during sex. You feel pain during urination because of the bruises you've sustained from the itching. And when urine touches these bruises, you feel pain. Likewise, during penile penetration, you feel pain also. And those factors that can cause reduction of the good bacteria and multiplication of the fungi are pregnancy due to hormonal changes, washing the vagina with soap, which changes the pH of the vagina, making it less acidic, vaginal douching, wearing of wet or damp panties, and also the use of antibiotic, which kills the bacteria in the body, including the good ones. Disease conditions like diabetes mellitus and menses can increase your risk of vaginal candidiasis because the menstrual blood is alkaline in nature, which neutralizes or reduces the acidity of the vagina, leading to overgrowth of this fungi and subsequently candidiasis. Vaginal candidiasis is treatable and it can be treated with antifungal, which could be tablets, which is taken orally, or pessaries, which is inserted into the vagina. This pessaries comes with introducer to insert the pessary deep into the vagina, and also cream, which is applied on the vulva. To prevent and treat candidiasis, you should avoid indiscriminate use of antibiotics, avoid wearing of damp or wet panties, use only clean water to wash your vagina, wear breathable underwear with cotton materials which allows air into the vagina, and ensure your blood glucose is well controlled if you are diabetic. However, some people have symptoms like burning sensation, itching, and irritation without vaginal discharge. If you notice this or anything abnormal, please talk to your physician for treatment. The next one is gray or milky discharge with fishy odor. If you notice a grayish or off-white vaginal discharge, it's a strong fishy odor, then you could be having an infection called bacterial vaginosis or BV for short. This type of infection occurs when the normal or the good bacteria in your vagina, called the lactobacilli, are replaced with the bad or harmful bacteria. The good bacteria are the soldier guarding your vagina from any harmful invasion by producing an acid called lactic acid as their weapon. But when these good bacteria are killed or reduced, it gives room for the bad ones to harm you. You can imagine you left your gate opened without a lock or gate man. Anybody can just come into your house to steal or even harm you. Likewise, without the good bacteria, the bad ones thrives and harms you. Note that bacterial vaginosis is not a sexually transmitted infection, meaning that you cannot contact it through sexual intercourse, but you are at risk of it if you are sexually active because the semen is alkaline in nature, which increases the pH of the vagina. That is, it makes the vagina less acidic, making the bad bacteria to thrive. Factors like vaginal douching, washing the vagina with soap, intrauterine device, use of antibiotics, smoking, and even hormonal changes during periods can predispose you to having bacterial vaginosis. The fishy odor from bacterial vaginosis is not due to poor hygiene, but imbalance of the vaginal bacteria, and the smell often disappears after effective treatment. Bacterial vaginosis is treated with antibiotics, which is prescribed to you by your physician. Avoid self-medication as incorrect treatment can make it to return. To prevent bacterial vaginosis, keep yourself clean, avoid perfume or scented product down there, avoid vaginal douching, and always wipe from front to back, as wiping from front to back brings harmful bacteria from the anus to the vagina to contaminate and infect it. Another discharge you can notice is yellow or green discharge. When you notice a yellowish or greenish vaginal discharge, especially when it is thick, frothy, or has a foul smell, it is an abnormal discharge which could indicate sexually transmitted infections like trichomoniasis, gonorrhea, or chlamydia. This discharge may be accompanied by itching or even pelvic pain. This infection could be gotten from sexual intercourse and you can sexually infect others. Note that many women do not show signs when having gonorrhea or chlamydia, and this makes it to spread or ascend to the pelvic, causing pelvic inflammatory disease, leading to infertility, ectopic pregnancy, or chronic pain. And that is why if you are sexually active or you have multiple sexual partners, you need to go for routine STI screening for early detection, treatment to prevent complications. You need to see a healthcare professional if you see this type of discharge, as these infections require specific antibiotics depending on the infection. And don't forget that your partner also have to be treated to prevent reinfection. Always practice safe sex by using condoms to prevent reinfection and do regular routine STI screening. Finally, the last discharge I'll be talking about is bloody or browny discharge. Brownish or bloody discharge usually happen at the start of your period or after your period ends. This could be because of the oxidation of blood due to slow movement which deprives it of oxygen, and could also be the endometrial lining, which is quite normal. However, frequent brown discharge between periods or after sexual intercourse, or if it comes with pelvic pain, may be signal of abnormalities like hormonal imbalance, fibroids, or cervical issues. Also, if it happens around the time you're expecting your period and you recently had an unprotected sexual intercourse, then it may be an implantation bleeding, which means you're pregnant. If you also notice this type of discharge repeatedly, then you need to see your doctor for proper evaluation and treatment. Ladies, your vagina has its own natural balance, so any sudden change is your body's way of saying, hey, something is off. Don't ignore it, please. Always see your doctor when you have strong, unpleasant, or fishy vaginal smell. Talk to your doctor when you're having itching, burning, or swelling of your vulva. When you notice unusual colors like yellow, green, gray, or you feel pain during urination, sexual intercourse, don't ignore it, please. Also ensure that you see your doctor when you notice that your discharge suddenly changes in consistency and amount. So lovelies, vaginal discharge is not something you should be ashamed of. It is your body's way of keeping things clean and balanced. The key is to know what is normal and pay attention to changes. Keep your body clean, have safe sex by wearing condoms, wear cotton underwear, stay hydrated, and eat balanced diet to support your reproductive health. If you found this video helpful, please give it a thumbs up, subscribe for more informative content like this, and share with your friends. Thanks so much for watching. Stay healthy, stay confident, and I'll see you in my next video.